those that are here. Good morning, everyone. My name is Mike Parker. I'd like to welcome you to the Incarceration Prevention Reduction Task Force. You're attending the Behavioral Health Subcommittee. Today is February 21st, a little bit after 9 a.m. We are meeting in hybrid, although I don't see anybody in our conference room. Is that correct, Jill?
That seems to be the case. Thank you.
I see an empty chair. Okay, great. Well, again, welcome everyone. And as always, we begin our meetings with our land acknowledgement. So I'll go ahead and begin with that. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who've cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us here together today. And join us in uncovering such truths at any and all public events. So with that, I'll go ahead and call our meeting to order. We are shy of a quorum, but that should not be a problem. We don't have an action item in this particular one. So Jill, in our agenda, I believe we just have one kind of big item, which is really looking at a recap of 2022 and then what's ahead of 23. For those that have been with us for some time in the Behavioral Health Subcommittee, this will probably be pretty familiar. We always want to get a little bit of a take, kind of report on how we're doing on what did we set out to do last year. But we really want to look forward to what did we miss and what do members believe is going to be really important for us to tackle. So if you would all just permit me, I prepared a couple of notes from the recap, and I'm sure you all read Jill's annual report. But what I wanted to do is just tease out a couple of pieces that are specific, I think, to the Behavioral Health Subcommittee and what we've all been working on. Oh, Heather, it's nice to see you. I see your name peeping in there. Nice to have you back with us. First up, some of the big things that happened in 2022. We invited and received presentations on the 988 system and also on the Whatcom Resource Information Collaborative, or RIC. I believe that was Christy Letty. Jill, am I getting her name correct?
Close. It's Christine Sleddy.
Christine Sleddy. Okay, really close. The RIC, just as a reminder and why it was particularly germane to our group, seeks to connect any individual who might need a community service, kind of a no wrong door. And our group is particularly interested in folks exiting our correctional institutions and how can we connect those individuals quickly, rapidly, and in a way that they want to services they need. The RIC could have some promise. That was one piece we had. 988 rollout, I believe you all kind of remember that. That's our suicide prevention line. It's a nationwide number. There's a lot of pieces to that, and we learned some of the complexities about that in 2022. Something that spawned quite a bit of work, and I'll let Stephen and Brian maybe talk a little bit about that. But we started talking about a behavioral health wish list of priorities that we might have for the legislature to help us with. So obviously we know in Whatcom that we've got behavioral health issues to work with on our own, but we need some help in some of those areas, or we may not have authority to do so. So we, after our presentation with Joe Valentine and Representative Alicia Rule from the 42nd, began a little bit of a journey, and I'll defer that because I want to talk more about that. Another big piece that we looked at is we looked at workforces, and we've had our own members talk about their behavioral health workforce, whether that be from the Public Defender's Office, Mike Smith, who's running Lake Whatcom Treatment Center's co-occurring disorder program. We've heard from all areas of our criminal legal system, whether that be providers in and out of our facilities, whether that be inpatient or outpatient. There's been challenges all across the board. It was a huge priority in 2022, and I believe probably will continue, assuming you all agree. This group also, through some of its members and then some presentations, we updated the SIM. So just the reminder for folks, that's a sequential intercept model. That is kind of our theory, if you will. That's kind of our North Star a little bit about how we suss out what's important and germane to making improvements and continually improving our criminal legal system. So that was a big move, and that was finished in the summer. And then, of course, used by the Stakeholder Advisory Committee. Speaking of that group, that they have submitted their report. If you haven't read it, I would get into it. Jill, that has been sent to all members, correct? Including subcommittee members? The SAC report?
I'm sorry, say that again, Mike. I'm at my attention.
Yeah, the SAC report that was created.
Yeah.
Okay, so everybody's got that. So if you haven't had a chance to read that, I really encourage you to do so. A lot of work went in there, and we want to make sure it should be reflecting accurately what this committee brought forth. But really important to read and understand. And I would say if you go to that next step to support, I think a lot of us on this call know that we need a new jail facility, and how do we shape it and how do we make it a system that works? So that was a big thing in 2022. Another area that this committee looked at in 2022 was collaborative responses. So Dan would normally take this piece as he would talk about alternative response programs. I see Mike might be able to fill in some of the blanks for us, but obviously this was a big creation year. Response Systems Division of the Health Department, getting things under its wing and including the new alternative response program. And as a reminder, that's for the city of Bellingham. You could call 911, and in this system, you might actually get a behavioral health response instead of just a uniformed response. We also would like to, in 2023, get updates from the Sheriff's Department, who I believe is hiring for their co-responder program. So we've got a couple of different co-responder programs that we've followed in 2022, and I would like to advocate we look at in 23. We always look at, and I kind of thought about how we do this, like, what criminal, legal, behavioral health challenges, and sometimes it's a new law, sometimes it's a new drug. And in 2022, we looked at a couple of those things. In the beginning of this year, we looked at xylazine. That almost made it into this agenda. We do want to follow up on xylazine. We think this forum can be useful to get kind of all of us looking at it from the various different ends, from a treatment end or an enforcement end, and also in looking at where the gaps are, what our community might need. Xylazine, for folks that don't know, is yet another synthetic tranquilizer, believed to be even more stronger than fentanyl, which is already causing a lot of issues this community deals with. And the last piece that I showed that was kind of a carryover was in relation to art. We did want to elect newly hired, not new anymore, but Chief Mertzeg from the Bellingham Police Department to talk a little bit about their piece of the alternative response team, how that hiring was going, and how things were happening for them in 2023. So that's kind of a little recap that I put together of kind of what we did, what we looked at least some of the bigger pieces. What I'd like to do for just a moment before I go to members, because I would really like to get your take, and there's going to be an opportunity for some discussion. Brian and Stephen, I think it might be useful to talk a little bit about advocacy efforts that stemmed from that meeting that we had, and I believe it was in October of 2022. And if you care to share any thoughts to transition into 2023 and what we've learned and how we might take it there. Brian, can I pass it off to you for a little summary about advocacy efforts and where we're going? Brian, I think you're muted if you're chatting.
Thank you. If the members recall, I believe it was in our December meeting when we did a little briefing on our one pager about 4 of the issues that we were bringing forward and talking to the 42nd delegation about. And again, as Michael mentioned, this was in response to a request from Representative Alicia Rule on what were some of the behavioral health needs, both operating and capital, from Whatcom County. And so Stephen and Michael and I have had multiple meetings in some cases with both Sharon Shoemake, Alicia Rule, and Joe Timmons, and those are continuing. And we want to go into the issues particularly at this point, but this is just the process as I recall. And then also we reached out to Barry Buchanan as well as Tyler Schroeder, Jed Holmes, and Eric at the health department. And separately, Alicia had asked them for some capital funding requests, and those have emerged. And we're actually sort of taking those, the three of us, when we meet and talking about those. And Tyler Schroeder shared just last week, those have developed into 2 or 3 separate capital project requests specifically that are co-sponsored by Rep. Rule and Rep. Timmons. So I think one of the takeaways from this is that I think for next year that we develop maybe a more collaborative process with the executive and the health department. I think that would be put the best, interests of all of the parties in Whatcom County forward. Not to say that I think what we haven't done has been successful in raising issues with our legislative reps, but I think all parties agree that if we can have perhaps a little bit more collaborative process next year, that would be helpful. So I'll just stop there. If we want to get into some of the issues, we can do that, but that, as I understand it, is kind of what we've accomplished so far between, say, December and now.
Thanks for that, Brian. And just a quick recap, that it started off with a presentation to our entire subcommittee, a group of ours, including Courtney, who I see is on our call today, Arlene, Brian, Stephen, myself, Dan Hamill to some degree, then met and talked about what are we seeing in the behavioral health subcommittee. So we kind of looked at like our minutes. We look at what issues are we seeing. We look at from a defender's, perspective, what do we have? We look from a prosecution perspective, and we try to elevate some key things. Obviously, those you don't get to give your entire laundry list. It's more like a wish list, and we honed it down. So I just want to give a little credit to the people that participated in that process. And one of the reasons I wanted, and thank you, Brian, for talking about that. I think in terms of timing, we're going to probably be looking at like May, June. So this is kind of just a heads up for committee members that I think a regular feature of what we do might be identifying throughout the year those items that we need some legislative help with. Sometimes that can be a cash, that can be asking for a particular dollar amount to help something. Sometimes it can be for dollars to study a particular issue that we don't seem to have staff time to be able to do so. And other times it may be to fight a particularly difficult bill or to address a piece. But just acknowledging that we don't have the purview always in Whatcom County to fix all of the problems. We're often left with things that we need others' assistance to do. So excited about the potential of what we'll be able to do with that. Stephen, anything more to add on the advocacy piece or kind of what's happening now in 2023 with that?
Well, I would just emphasize the value of the connections we've made with the executive branch and the county council, as Brian reported. I think there's a broader understanding of the need to work together and to work earlier on, as you say, in the year, Mike, to start developing that. I also think that a number of the issues and the response to them made it clearer to me that we may need to turn back locally or regionally, I think. And I think
Is he a bit frozen or is that just my connection?
He's a bit
I think
frozen.
that's another benefit through the.
Stephen, our apologies. You're a bit frozen. We're getting like every 90th word.
I'm frozen, I'm sorry.
Yeah, you were kind of freezing and unfreezing there. Although those look of
How am I
surprise
now?
about the same, I think.
Yeah, maybe go without your video, Stephen. That might be helpful for talking.
Thank you, Mike.
Yeah.
And if we could trouble you, unfortunately, to repeat some of what you said, because
Is that any better for the audio?
it is much.
Okay, thank you, Mike. I was going to say, I think the other takeaway I have is the potential value of of sort of a regional focus, working with Joe Valentine and the ASO. Some of the things that we proposed in our legislative wish list haven't gotten a lot of traction, but alternatives are cropping up. So I think the proposal that the executive branch and the health department put in for a capital project aligns with the needs assessment that the ASO did regionally. And there are other potential avenues to work cross county. That was part of a discussion that's really picked up some steam locally. Oh, doesn't look like that's moving successfully in the legislative session. There may be some momentum building to look at alternative ways to approach that roadblock. So I think it opened up some possibilities that we didn't even see before on some of the issues that we highlighted in the wish list.
Stephen, thank you. And I think the last piece you were talking about was competency restoration. Is that right?
Yes, it was.
Okay, great. I missed the noun. I think you had a little bit of
Sorry.
a pause in the audio. No, it's not your fault. The technology happened. So, and to what Stephen mentioned, I'll just add a little bit for committee members. A small group is meeting ongoing to look at competency restoration and what we might be able to do at a local level. There's a lot of priority in the governor's budget regarding new facilities and things like that. But the problem in the jail persists. The conditions are really rough, and waiting to have any change until some future change on the state level, we're not necessarily satisfied with. So the group that is meeting has folks from the defender's office and prosecution, and Chief Jones of the jail is really trying to look at collaboratively and out of the box solution. What can we do to maybe move the needle in competency evaluation and restoration given the log jam? So again, like Stephen said, sometimes the offshoots, even when you're frustrated, can create some innovation. With that, the last piece, and this is not the last because it's last of importance. It's last because I wanted to spend a little bit of time on it. As y'all remember, the county council has embraced and paid for membership into the Government Alliance on Race and Equity. And in 2023, I would just posit, I think we made some modest moves in 2022. And just from my standpoint, it doesn't feel like enough for far enough and fast enough. So I hope 2023 is better. And to whatever extent members of this group are interested in helping move our ability to respond, to look at data from a disaggregated perspective, to really bring that racial equity lens, I think we can use all hands on deck in that way. Stephen, are you aware of any particular moves? I mean, there's conversations in the steering committee about composition, which I know is foundational and seminal, but about, we were going to convene a group, I think, to kind of look at some of the recommendations that were created. And do you have any update maybe for our group really quick while I'm talking about GARE in 2022 and into 23? I may be asking Frozen Man.
I've been putting something in Jill's inbox to try to convene that group and begin those discussions. If folks will recall, we sort of expanded the racial equity discussion group looking for suggested ways, mostly to begin with, process ways to implement the racial equity toolkit analysis in our work. So I'd like to sort of re-kickstart that discussion and do that soon.
So I think more to come. We'll have that on a future agenda, and when there are opportunities to join, obviously, as your time and interest allows, committee members, we do invite you into that process and want to raise that tent as large as we can. So really quick before we move on to, I think probably what to some might be more interesting is a little bit less summary of what we did and more like what do we hope to do for 23. Anything on 2022 that we kind of missed? Okay, Heather Faraday, please.
I just have a couple of questions more than what might have been missed. I think it might have been 2021 that we wrote the letter to our county about ARPA priorities. And I think some of those have made it, it sounds like, into legislative priorities, which is great potentially. But I would love to hear a report back from the exec's office on what is happening with ARPA and what happened after we made those requests. And similarly, I also think it'd be great maybe to have a joint meeting sometime with the Behavioral Health Fund Committee and to get a report on what the Behavioral Health Fund of the county is doing and what their outcomes are, and if there are efficiencies that we could achieve working together. And then I have other questions, but I'll save them for after the 2023 look ahead, what might be next for us.
Great, Heather, really quick, thank you for that, and I'm taking notes. So was that the Behavioral Health Revenue Advisory Committee? Is it still named?
I think
that?
so. I don't
Okay.
know the specific name, but that sounds right.
But it sounds right. And they essentially advise the health department staff on where to invest and where to spend. And now that there's a fund balance, I think that's a particular interest, right? Okay. And you're suggesting possibly like a joint meeting or maybe invite for a presentation or one or both.
Yeah, honestly, the Healthy Children's Fund passed, and there's really robust evaluation written into that that fund, so much so that we've had people say this could be a model for all funds in Whatcom County government, because there's a requirement to measure the impact and the outcomes. And I would love to see that for the Behavioral Health Fund too. There's always revenue coming in for that fund, I understand. And what is that fund doing and what are the outcomes? And are we seeing any population level outcomes? Are we seeing programmatic outcomes? And then we can tell those stories better in our community as well. Because I think that's also a key part that everybody here has talked a lot about. How do we get the good stories out too? So, and with our shared agendas or overlapping at times agendas, it would be great to understand more about the ins and outs of that fund and where it's going.
Mike, if I
Great.
could add to
Please.
Heather's comment, which as usual is pretty cogent for this group. I believe that is now called the Behavioral Health Advisory Committee. And one of Jackie Mitchell's last efforts as a county employee was to recruit me to that committee, and I just got appointed. I haven't yet attended a meeting. They only meet quarterly. My impression is that it's a bit in transition, as a lot of health department advisory committees are. So I think it's looking for a little bit of direction. I'm glad to be a conduit of information to our committee on that, which is not an instead of, but and in addition to Heather's suggestion of a joint meeting. I don't know yet what the value of that might be. I'll get a better look once I start getting involved in, but just to emphasize, we now have sort of a formal connection to that group.
Thank you both for that, Brian.
Yeah, I just wanted to mention, this may have happened in early 2023, but we did make a couple of data requests of the public defender's office and the sheriff related to the length of time that people are in the jail and do not receive medication for those that need medication, and also some data on the competency restoration process and how long people have been in jail before the competency restoration services are provided. And I just wanted to underscore that because I think it's important as we move forward on issues like those, that we have some specific data to know what we're dealing with. So I just wanted to point that out as kind of something that I would like to see us continue to dive into going into issues to follow up on in 2023.
Thank
And
you for that, Mike. In your mind, those particular data requests, are we still outstanding any of the requests? Are we still kind of waiting on any of those data in your mind, Brian? You mentioned two, medication kind of process and competency restoration. How many folks are waiting? What's their average length?
Yeah, I believe Under Sheriff Chadwick is working on those two. I haven't seen anything so far in response to that. And either Courtney Taylor or Lisa Vano sent some data, which I believe is statewide, to the whole group from a slide deck that the Healthcare Authority or DSHS sent out. But specific to Whatcom County, and maybe people who are on the call can respond to that. I think those requests are still in process.
Hi, Brian. This is Courtney. My understanding is that Maya is still working on that, but you are correct. We have reached out about that.
Under Sheriff Chadwick, I see your hand up and I saw your camera come on.
Sure.
Please.
I just want to comment on that as well. I pass that information on to Chief Jones. She is working on it. That our current database doesn't allow us to just run a specific report for that, but she is essentially doing a manual analysis of that so that she can provide that information. So I will follow up with her after this meeting and see where she's at with that. But I know within the last 2 weeks, she mentioned it and that she was something that she was working on.
So, Doug, I just had a follow-up question. So the state has like statewide data, so that the county jails must feed into. So I'm just wondering, is there some kind of process or that you're aware of where how all that data gets accumulated?
Yeah, I'm not sure specifically. I don't have that answer, but I will certainly follow up and I can try and shoot you an email later today if I can get that answer.
No, there's no urgency to this, but I was just curious where we're getting the statewide data. I'm just wondering how is all that compiled?
Sure.
Okay.
And Doug, not to muddy the waters just a little bit, but I think that Jeremy Morton over in the RSD division is doing a bit of that work for you guys. I know that we just redid some data sharing agreements with Wendy's group over there, and I don't know if they've been signed or moved through your system yet, but there is some attempt to do some data sharing agreements, and I think centralize that over in Amy Hockenberry's group and Jeremy at the moment. So you might check with them. I'd be glad to do it myself as well, but I think that's where some of that's going to get centralized on that Justice Center project that's related to that.
All right. I will have Wendy follow up with Jeremy as well.
Yeah.
Thank you all for that good discussion and some of the reminders. I wrote down a couple of different points that really some things to continue to track. And if there aren't any other hands for things at 2022, oh, please go ahead, Heather.
One of my things that I was going to say for 2023 was a data question. I'm wondering if I should just add it right now to the data conversation.
Please. That's a good
Okay.
juncture.
So one thing we learned in 2022, at one point, we learned that I think it was close to 98% of our current jail population was pre-trial. Before COVID, it was 60%, and even at 60%, there was urging to reduce that even 60% was high, 98% pre-trial. And we also learned that many of those, maybe half or more, were awaiting competency restoration services or some sort of behavioral health component. And my question, I just have a lot of questions about that. And one is, of those people who are awaiting competency restoration, what kinds of charges are we seeing associated with that? I think that is actually a really important question to ask as we're thinking about what kind of facilities do we need to design. And I could go on with probably 8 more questions. It's a huge data research curiosity of just who is in the jail and why, and what actually do we need moving forward to better serve this population.
Courtney, is what you had particular to that? If not, I'll come back to you.
It is just speaking
Please.
broadly here to kick off Heather's question. I want to return to something I said a while ago about this being a philosophy shift and restoration. Really, the way the system functions as it is, it really begs the question: what are we calling a crime? And what are our responses to that collectively, the different pieces in this system, whether it's defense or prosecution. So again, this is a broad stroke, but I will say that a large portion of folks stuck in restoration, these are not things that we would consider, that the lay person would consider a serious crime. But again, this is anecdotal for me and just my experience in this work. I'm sure others have their own perspective, but I think what we're doing, the conversations we're having around restoration, absolutely needed. They have to be had. That said, we need to back up a little bit and look at what's happening at the prosecutorial level, because there is a huge issue with overcharging folks that, from my perspective as a social worker, they shouldn't have to enter this process to begin with. But that is a more complicated conversation that we could be here all day for.
I'd be glad to be here all day, any day for that conversation. I think it's critical, and I'm really grateful to hear that perspective, Courtney, and thank you for sharing that.
Thank you.
Heather, were you able to kind of encapsulate, if you will, kind of your thoughts and your particular questions regarding competency evaluation, who's in the jail, characteristics of those, what charges? Did you feel like you got that more or less out? Okay. And Under Sheriff Chadwick, your hand was just up from a previous time. You weren't responding to Heather. Is that correct?
I was just going to comment on the fact that a large majority of the people that are currently in jail are there on felony charges, just because of the, past few years of pretty significant booking restrictions. Lower level crimes just are not being booked in, or it's a book and release. So the majority of the people that are there on felonies. But again, and I don't know the actual percentage that are awaiting competency. I don't know that it's 50%, I think, is the number you threw out there, but certainly there's a significant number of people that are waiting, and that wait is significant. So we would certainly like to see that expedited.
Stephen and I and others participated in the first of a series of meetings, kind of collaborative meetings that I mentioned briefly. As kind of an offshoot, right? We went to with an advocacy ask and realized we needed to do our homework and look kind of at how many people we had waiting. What could we do locally to maybe, deal with this log jam? Stephen, I don't know. It's a bit early to talk about things out of that work group because it's in its first meeting. But just to Heather's point, I wondered if you might characterize just a bit of the conversation that when the prosecutor and defense and chief of the jail were all talking, that they seemed to kind of share a little bit of a view of this problem. And there was some concurrence in thinking about low-level offenses, maybe not even charge. Can we even increase diversion programs at the time of arrest? Can we build on lead? And Stephen, I wondered if you might jump in just briefly and maybe you have a good way of kind of encapsulating those conversations and maybe share the part that's germane to what Heather brought up.
Well, I'll try, Mike. As you said, it was the very early stages of that conversation, but I will say, to Courtney's point, that Stark and Myelisa were both active participants in that. As were Eric Ritchie and Eric Sigmar. And I think there was some attention, and I think that was thanks to Maya's initiative at a program model from elsewhere on prosecutorial diversion as an alternative to running people through the charging process. Well, I'm not sure if it comes before charging or after. That was part of the conversation we didn't quite get to. But there are some alternatives to competency restoration and the systemic incapacity we have right now to deal with that. And I think there was an openness to looking at alternatives and some changes in the charging decisions. I think we didn't get far enough in the conversation to hit the usual points of disagreement about that. So I'm not sure we've overcome those, but it was an active conversation. It did include the parties that it ought to include. And there's enough pressure from the just totally unacceptable situation we find ourselves in, both in the numbers of people and the dysfunction of the process, to hold out some opportunity for making some progress on this. Beyond, I know that's a lot of blather, really, but I'm not sure I can say anything more at this point. Mike, I don't know if I missed something that you caught that seemed more reportable.
The only other piece that I would add is all these arguments are just so like what that group is talking about. And I was pleased to hear that. As Stephen said, there's no like summary or there's nothing decided. It's going to be a process. But a couple of the pieces that were hopeful, just some comments that I'll just share was, realizing that it may be a long time before we get any help from the state, from the True Blood settlement and this log jam, which is clogging our jail. I mean, I would argue it's to some degree who we arrest and who's in jail. It's also the process at the other end, which is not set up and is not able to receive the people from our criminal legal system. It's forcing a lot of innovation. And I think the LINK program in Seattle is worthy of looking at. It's another diversion program. It kind of couples with LEAD. So since we already have some ground resources already working in LEAD, might we be able to use that vehicle to go even further? And could it help, to Heather's point, with some folks that may end up for not really very violent charges or non-felony charges? Could we maybe even keep somebody out of the competency restoration process in the first place and evaluation? Could we divert those individuals? So I think there's good conversations to have in a future kind of direction. I would also highlight to committee members, and I was going to say this to the end, but our joint meeting, which is going to be March 14th at 11:30. Jill, please fact check me if I got that wrong. But our next meeting will be a joint meeting with Legal and Justice. And this topic, Dr. Thomas Killen, who's from the DSHS Office of Mental Health Services, essentially the group that oversees competency restoration for the state of Washington, is going to be attending and giving us a presentation really geared towards if counties that aren't in a true blood settlement region want to take something on, what might it look like, and how might that county go about that process of kind of formulating a possible program. So I urge you, if you're able to join that conversation, to hear obviously what they have to say, but also to be part of the process, because I think this is going to be a big area of work, I'm guessing, for the task force, but really for all of the associated parties, prosecution, defense, and the jail, to figure out how do we move forward, because I think there's an acknowledgement we're not going to get any relief soon. Mike Kelly?
Yeah, thanks. Sorry about unmute button. Just before we get too far away from the conversation, one of the things, and you alluded to it already, and we probably already know this, but on the front end for these even smaller things, people aren't getting arrested anymore. And it's creating a narrative in the community of why even call. And I got to tell you, saw a bit of that here a couple of weeks ago, where a coworker had their rig stolen out of our parking lot. This is the third time that rig has been broken into. BPD found the rig pretty quick. I went up there with the coworker to get the vehicle back and see what was going on. They had the person in the back of the car. Obviously, the officer took this person out of the stolen vehicle. There were tons of stolen stuff in it. They did drugs in the vehicle, it was a hazmat and the whole thing. And so the conversation sitting on the curbside is, well, I don't know what to do about this. I mean, you can go ahead and press charges if you want, but nothing's going to happen. They'll be back out. And so there's this sort of, I don't know, in my perspective, talking people out of making that report. And I sort of get it. I mean, the officer wasn't wrong, but there's something wrong with that. And we did not feel good about that, especially with this person being in the back of the car already. And I kind of go back to this idea that in that scenario where a person was caught red-handed in the vehicle, why is it up to the owner to make the decision to prosecute when that person was arrested by the officers in the first place? Because if that coworker had not been in town to make that statement, would that person just been left to go? Or would they been arrested without the benefit of the owner saying, hey, press charges? And so I don't know, it was a very uncomfortable feeling for us. I'm not saying the officer did anything wrong, but oh my gosh, out in the community where this has happened multiple times a day, at what point do you just not call anymore? So anyway, I think that's the front of this jail backlog too. That's stopping all this up. So I just, we didn't feel good about that.
Yeah, that doesn't sound great. Courtney?
Hi. I just me not being there, right? I don't know what happened. I'm wondering what conversations were had with the person at arrest with the officer about what they might need and what led to that situation. Because on the defense side of things, I have to say I'm seeing a lot of folks who are arrested in similar situations to this gentleman that Mike's describing. And again, I wasn't there, but what we're seeing happen is there's this kind of black and white thinking of, do we let them go or do we take them into jail? And there doesn't seem to be a conversation about the in-between, and not knowing if this might not apply to this gentleman in this example of Mike's, but thinking of someone else where this came up, very similar circumstance. There was no conversation about crisis or the hospital or other resources that we have locally. And what's happening, because crisis triage is not actually licensed to perform ITAs, there is a lot of go between triage, the hospital, the officers who are responding on scene. Everybody's trying to do their part in that equation, but people are not really being diverted in the ways that they potentially could be. And again, I don't know if that could have applied to this circumstance with this gentleman that Mike's referencing, but I'm wondering what conversations were had about the resources that we know exist, and was that conversation had? Because sometimes there's this assumption that people don't want services, but nobody's asking. And I can't tell you how many of my clients who have been allegedly in the back of a truck or a car or something else, just like this random person was described, people assumed or perceived that they were using. They may have been in a mental health crisis, we don't know. But that person, there was no conversation about resources. It was, are you going to walk away or are you going to go to jail with us? And that keeps happening. And I have to ask why. We have resources in this community. They're not what they could be, but there are some bridges that we're not tapping here.
Under Sheriff Chadwick.
I was just going to add again, sounds like it was maybe another agency, but obviously officers have discretion to, arrest, not arrest. A lot of times that conversation starts with the victim of the crime. If they want to press charges, certainly the expectation is that they not talk somebody out of wanting to do that. But as Courtney said, there's a lot of different circumstances that come into play. Again, the level of the crime, the ongoing risk to the public. Obviously, all the officers know in Whatcom County, whether it's the sheriff's office, Bellingham Police, or any other jurisdiction, we've got severe booking restrictions. So that obviously has to, is it something that they can actually be booked into jail for? But certainly, if there's a conversation there, the officer, if the person wants to press charges, that the decision to prosecute is not necessarily the deputy or the officer. That comes down to the prosecutor's office. We could actually make an arrest, and then the prosecutor can decide not to prosecute that case again, and they may factor in some of the circumstances that are being discussed here again. Was the person in mental health crisis? What is the ongoing risk to the public? What's their history, things like that. So just want to kind of, some of those discussions that go on. But again, there's a lot of factors that are into play right now. And like I said, officers are definitely considering their ability to book people into jail. Now, they could maybe book them, but they would be released in a short period of time. And again, that person, if they're going to be back out on the street committing a crime, that may be part of their consideration as well. So a lot of things that really are outside the officer's control, but I certainly understand from a victim's perspective how that could be frustrating. And we hear that quite frequently, all around the county and especially here in the city limits of Bellingham.
Mike, you brought an interesting test case, and I'm wondering if you might have any response to Courtney's kind of question about what was offered to that particular individual. So since we're in this rabbit hole just a little bit, and I think it's actually a good piece of conversation for this group because it kind of embodies what we're talking about, but in a realistic case. Mike, can you cover that at all? Were there any options given to the individual? Were you, from what you were reported to, I guess you weren't there, but.
No, actually, I was there, and went through the conversation with the officers. And yeah, Courtney, there were a lot of those components there. And Doug, I mean, this was a person living on the street. They stole the vehicle. They stole the vehicle so that he could tow another vehicle that he was living in up to another remote location. The vehicle did not drive. And so this guy had about, 50 different keys to vehicles in this big old ring. And so had knowledge, sounds like the guy was experienced auto theft person. And yeah, drove this vehicle around for about 3 days in order to move it to another location to live. And on top of the rig, there were dozens of stolen bicycles. There's all stuff around this big van that was stolen. And so, yeah, we arrived, the person was in back of the vehicle. We didn't get, or in back of the officer's car. We didn't get to talk to him, but all those components were there. And that was the discussion I had with my coworker, which is, boy, this is a client that we know out there through our GRACE teams. This is somebody that, we're trying to help case manage at the same time. The uncomfortableness, I think, came with, at the very least, not having some type of notation that this person was a serial, thief. And so how many times does this person go unnoticed or unarrested or unbooked, continuing the same behavior out there? So yeah, those all components were there. I don't know that there was any alternative offered to the offender or the alleged offender on this. I mean, I don't think there's any place to go but jail at this point if you're going to book somebody and get them out.
I would like to counter that, Mike. I'm hearing a lot of descriptions about the outside perception of someone's struggle and poverty and using that to justify what we're calling a component. But really, I'm not hearing any component of care connection in that conversation. I'm hearing a description of the things that he carries on his person. And even if a person is a repeated offender, does that mean we don't engage in the conversation from the get-go? No, we should still ask.
Yeah, no, I agree 100%. And like I said, I think those were parts of it. If the officer was having that conversation with the person, we just weren't privy to that. We just weren't made part of that conversation, and a little bit out of my lane because it was my vehicle to make that decision on. But I'm not sure that conversation happened. But I wasn't there.
Heather, I see your hand back up.
So I think about what you were saying about kind of a paradigm shift of what are we defining as crimes. And then I hear that story about, the jail's full, we can't book them it'll be a book and release. And so what's the point in even bringing them in? And that's frustrating for officers because they feel like that tool isn't there for them, it sounds like. And I just am thinking about, what is the goal for the whole system? And are we all working together in the same direction? And from my perspective, the goal should be what actually creates public safety. And what I'd love to see, I wasn't there. I know I don't know what I don't know. I have a lot of humility in this opinion, but I wish in those circumstances, the officer could think, okay, what in this situation will actually create more public safety in the long run? And that they were equipped with more tools than just a jail, that it could be that diversion to something, or what would actually stop this person from stealing a car again? And how can I get them connected to those places? Even if we're not condemning or punishing, but what would stop this person from stealing cars? And that we're solving that together as a community. And I don't know. I think that there has been this paradigm shift, and we have not been building the system that we can divert people to appropriately and adequately and with enough resources. And I think that's why we're still stuck as a community, that it's just a whole different way of thinking about it. And it's so hard. And I just want to offer that like, what is option B or C? And how do we get all of us thinking what creates more public health and public safety? Because even when the jail isn't full, that person gets booked for stealing a car. How long do they stay typically? You know, is it 3 months and then they're back out, and then what? They steal another car. Like, you're safe while they're there, but you haven't fixed the problem.
Thank you, Heather. And just to return to this example of this gentleman we're using, or so many other people I've worked with that we work with at this office. I mean, it's not, I think in that philosophy shift, we have to, so many of us, we have to let go of this assumption that people are trying to like con us or scam the system, or, you know, get something out of us, or there's so much of that underneath the statements that some of us are making. And it's just, people are trying to survive. And I understand that, I think a lot of us here understand that we have to respond to the ways people are trying to survive differently, because we're all trying to live in this world together and create this community that we feel safe in, where everybody can thrive. And that includes the people that they might have a bunch of possibly stolen items that we don't know what they're doing with it. But does that person deserve to be part of this community? Yes. Do they deserve to be part of a community that actually supports their stability in a way that they can thrive outside of theft? Yes. But will we have the answers on what they're doing with things, and, you know, how they're using their belongings? We're not going to have those answers. We should still help them from the get-go. We can't, there are some things that our paternalism is not going to solve, and that's why we're in the mess we're in now.
Thinking about how we take this forward, I think it's a really valuable kind of test case, right? And it kind of puts some of those values. And I at risk of broken record, but you know, as your co-chair, I get to occasionally be a broken record. And I think when people are housed, they do less of this stuff. And I was having a discussion with co-chair Hamill the other day about a city of Bellingham police, you know, pilot project that they teamed up with, and Chief Ramsey and Greg Winter, my boss in the Opportunity Council, and created a housing program for individuals that they were frequently arresting. A small pilot project. They did a little study on it. It was amazingly successful. The police actually chose the participants that would receive a housing intervention. And the idea was, what would happen if we give these folks housing and supports, right? It wasn't just housing, it was supports. And what would happen, and the results are really promising. So, you know, when I think of that situation and I hear about it, and the human side of me says, well, if he's living in a van, it means he's homeless. Could that be part of the secret sauce that he would have needed that day not be jacking a rig and to be taking pieces. And I am thinking of my language there, right? If we had met his needs, he wouldn't have to turn to crime in order to do that. And I don't know that that's the case, and that doesn't work for everybody. That's another thing the study shows, by the way. Some of those folks and some of their criminogenic factors, there may be another step before housing for that particular individual. But I would like to think that many of the folks that we are out there, or that like Mike is describing, that might be changed if they too could have housing. And I think we're about to hear this year, by the way, we may have a record number of unsheltered folks in our community, at least according to the early results of our pit count. I don't think this is going to be a great year. So, you know, as we look at a very full jail, a state system that is not helping us empty that jail, and really difficult conditions on the ground for people to get their needs met, like this gentleman's needs are just not being met. It's not going to be a ton easier. And I think in 2023 for a task force is figuring out, well, what do we do to move the needle on any of these pieces? You know, I brought up at the last meeting, and I know if any of y'all remember, but, you know, could we look at housing vouchers that might be targeted to people exiting from our criminal legal system, or maybe as diversion before entering in? And, you know, it's beyond the scope of this group to necessarily recommend all of the different pieces and all there's a housing advisory committee, right, that advises the county council and advises folks on these funds and use of home funds. But my conversation with Mr. Thane was, can we elevate this particular need of this population, of the folks that we are frequently arresting because they have no other choice? Might we target some benefits toward them? So we can continue to talk about that, but I wonder, Mike Hilly, if what you think about that. I mean, you see a lot of these Grace folks. I mean, is that so common? At one point I heard from Grace that 80% of the folks that they worked with were unhoused.
Well, yeah, I think that's exactly what's going on. And in what I was talking about was that was exactly what drove this person to do what he did. I mean, I'm not sure exactly where that van was before, but they had been told to move. And so this person's under pressure to get out of there before somebody comes and, you know, moves them for them. And so I think that was a little bit of desperation, which led to, you know, stealing the rig. And because that's what he did, towed that van up a hill to get it to another location with that Jeep, right? So yeah, no, that is a good part of that, of being unhoused and having your stuff safe and not having to move around, et cetera, et cetera. And that was the biggest component. I don't know how we do that on the back of the officers who are so busy to have that conversation too. And that's another issue is, boy, how much time do you spend with a person and trying to do that if you don't have a diversion option for them in the first place? And I think that's where we get stuck a little bit on that. You know, and you're right, the paradigm has shifted a little bit. You know, I mean, it's not what it was 4 or 5 years ago. You got your car stolen, police would come over, they'd have a super high interest in it, try to track that down for you, see if it's part of a chop shop deal. But anymore, it's getting in for the transportation need. And that's been my experience with all the cars I've had ripped off, which was I needed a rig to go shoot around town for a couple 4 hours. I'm gonna dump it and then I'll be on my way with it too. So it just creates that thing. But I absolutely agree. It's the unhoused right out of the gate, you know, which creates a good bit of these problems.
Laura, I see your hand up.
Good morning, everyone. Can you all hear me okay?
Yeah, great. Thank you.
I'm here. Perry Mowry is out this week, so I'm attending for him and appreciate the conversation so much. So just a clarification, 80% of the lead clients are unsheltered and about 50% of Grace clients. And so that's been pretty consistent over the years. I would say this conversation brings up the idea of referrals, and I agree that officers need a robust toolkit in the field to be able to connect and make connections in the moment. And beyond that, we would love to see law enforcement officers making referrals to programs like LEAD and GRACE. And we do have, you know, the behavioral health deputies, and we had the behavioral health officer at BPD, and those officers did a really good job in doing that. But we really see there's an opportunity for initial referrals to be made to those programs by officers. And so that's one area of growth. And then, of course, when the charge is submitted to the prosecuting attorney's office, there is another opportunity for a referral to be made. And so when we think about, you know, a no wrong door and a robust referral process, those folks who are really cycling and have maybe, you know, continuing to have the same types of charges, we can look and like, where are all the places where someone could have been referred, but they weren't. And so that's one thing that we're looking at, is just how do we make sure that we've done enough education, and that those different parts of our system feel like they can make referrals sooner than later. We shouldn't have to wait for Lighthouse Mission to make a referral for someone with low-level law violations, right? That it's great that they do, but we'd love to see our legal system really be able to identify those folks in a more organized way. And so that's one of the things that we're hoping to focus on this year, just from our program's perspectives, which are Grace and Lead.
Thank you for that, Melora. Anything else on this particular case and everything that came up about it? Courtney, please.
I just wanted
Sorry to step
to,
up the dust.
oh,
Oh, go ahead,
Sorry.
Courtney, please.
sorry, Mike, I think I cut you off. I didn't hear what he said.
I think he said starting to stir up the dust. He realizes that he brought us a pretty good test case here, but please go ahead, Courtney.
Oh, I was just gonna chime in with what Melora just said, and like from our office, just supporting and encouraging what the message Melora just gave, that we are also providing a lot of those referrals that could have been they could have been done much sooner from the LE level, or possibly the prosecutors. So that would be helpful from our office as well, just having more people involved in that referral process.
Melora, if there's any way that the behavioral subcommittee or the task force can be useful in your work, you know, that's a lot of officers to get in front of, right, to kind of spread your word. But if we can be at all of use to you in that process in 2023, please don't hesitate to let us know.
Thanks, Mike. I think that now that the programs are established, and that we've been able to build some relationships with our law enforcement partners, I think we feel like now is really the time to empower individual officers to feel like they can make those connections, where if we had tried to do that a few years ago, it probably would have fallen flat. So excited to kind of get that on the agenda this year, specifically for BPD and the Sheriff's Office, and then working with the other municipalities as well.
Great, thank you. So with that, we've kind of in a little bit of a jolty way, but we've transitioned into 2023. So if you haven't kind of taken up on that, we're thinking about things for this committee to work on. That can also be things for the task force to work on. So I want to open it up a little bit and a little bit further and see, you know, what particular items would you like to see? We've got some great follow-up items from Heather Flaherty. Thank you for that. Some follow-up items from 2022, but that'll be 23 business. But I wanted to open up the floor and give this to committee members to think about. It can be a new topic, one that the committee has not talked about at all, or it can be follow-up or movement on something that we brought up and didn't move. Yeah, Mike, please.
Yeah, thanks, Mike. And actually, I'll share this a little bit with Melora, because this is going to happen a little bit over in her group with the RSD. But we're having some very early discussions right now of what diversion from narcotic overdoses looks like in the field, from going from the ED as opposed to somewhere else. And the idea would be that that might be an intersection or an engagement opportunity to offer a patient Suboxone therapy as a bridge to recovery. EMS services back on the East Coast have had some limited success with sending teams out at the time of the overdose social worker, MAT provider have a conversation, engage a patient, and is today the day that you want to sober up? If so, we can soften that ride with a little Suboxone. Probably inpatient for a couple of 3 days until we can get that under control, and warm handoff into an MAT program for future follow-up. With Melora's nurse practitioner, Lacey McCauley, we're going to have some meetings early next week, I believe it is, just to map that out and see what that looks like from an organizational level. But we know at least up to 50% of the narcotic overdoses that we see in the field usually leave against medical advice. And the ones that actually do make it to the ED usually aren't as successful at staying in. At least typically they'll get a safety stop, but not necessarily an accepted. They always are all for diversion, or referral to the MAT, but many of those don't accept that as well. So we're open to create an engagement point at that level. And if that was going to be successful, you take services, maybe our community paramedic or our alternative response team gives you a ride over to the stabilization center. You sober up there a little bit for further inpatient down the line. So that's something for 23 that we're looking hard at and want to see if we can pilot and operationalize something like that.
That's great. Thanks, Mike. Anything else, Stephen?
Yeah, I'm gonna keep my camera on. Tell me if the sound gets weird again. I'm gonna articulate two things that are questions for me in the context of what I think we've learned together over a couple of years that might be worth looking into in 2023. I don't know where they would rank. But I do know that the Legal and Justice Systems Committee is giving some attention and priority to trying to flesh out reentry services in the coming year. It seems to me that the success of that would depend on the availability of the capacity of behavioral health services. The question for me is there anything distinct about the behavioral health services for somebody re-entering the community that might need focus or understanding from us? And then the question, does that distinct capacity actually exist? And so is that a kind of service that we should try to understand better and fit better with the needs of people coming out of incarceration? So the whole interplay between reentry services and the capacity of the behavioral health system to appropriately and in an individualized way serve the needs of a reentry population would be one question. The other is I forwarded around some information that talked about the efficacy of cross-trained co-occurring disorder treatment. We know the high incidence of co-occurring disorders. Mike, you mentioned Mike Smith, Lake Whatcom Center managing a co-occurring disorder treatment program there. I think that's unusual, and I get that impression from other people as well, that we don't really have cross-trained treatment providers. We certainly have a lot of anecdotal information, how people go to mental health treatment programs and they're told, well, we can't take you because you don't fit our criteria because you also have a substance use disorder. And the same from SUD treatment providers rejecting people for their standards because they also have mental health issues. So the ability to access co-occurring disorder treatment might be another area that at some point this committee might try to understand better and look at possible community responses to the lack of services in that realm as well.
Stephen, thank you for that. Could I just ask a quick clarifying question? When you talk about the second part where you're looking at the workforce and people trained to treat individuals with co-occurring disorders, were you talking about like formal treatment programs per se? Or are you talking about the whole spectrum, meaning like our shelters being able to work with folks who are co-occurring, or let's say maybe our housing programs being able to support those that are co-occurring? Were you specific to treatment, or are you looking kind of more systemically in that?
Well, I guess I was thinking at the time I was talking of the treatment part of things, but it would seem to me that you've made a good point that the broader social service network, that we're trying to wrap around some of the people would need at least a sensitivity to that. But I don't see how that would be very effective without having dealt with the availability of co-occurring disorder treatment services.
Yeah, thanks for that. I obviously it's a little bit of my soapbox piece too, but I think in all phases of working with folks, we need to be able to handle them however they come. And you so correctly said that frequently people have both, and who knows which one brought the other. It doesn't really matter. The fact is that most people need care for both. And if we have created siloed either treatment or housing or sheltering options that will treat only one part of the human and leave the other part and say we can't, it's going to be inherently problematic. So thank you for your point. Brian, I see your hand up.
Yes, and I'm not muted. I just wanted to underscore and support comments by Heather about having a joint meeting with the BHAC. I think it's really important. And of course, one difference is that group can address people under 18 and some of especially the pediatric, behavioral health needs in Whatcom County. But following up on that, I am more interested as well as continuing to ask, questions and get data to help us define the scope of the problem. And I also would like to have a session at some point this year on a King County auditor's report that looked at incarceration alternative and diversion programs, and their findings were in King County that improved strategy, data, and coordination, could help the county meet its goals. And I realize that's a kind of a lofty, aspirational goal, but I do think it would be helpful to ask some of those similar questions that were raised in that audit report here in Whatcom County. So, and I'd be willing to kind of take some responsibility for putting that as an agenda item and working, Michael, with you and Dan and taking a look at that. Also, I think it's really important that we do have a regional perspective. And so Stephen's comments about the ASO, I think if we had at least an annual session with the ASO in terms of what are some of their issues in the 5 county areas of the ASO, it would be good. It also might help us define more our legislative agenda, looking at where there are particular gaps in whether it's, treatment, case management, and facilities. I think it would help us kind of align better with, how we fit into that region. And then also, I think going forward in May every year, it would be good to have a briefing on state legislative, bills, capital facilities. Where are we? What did the legislature do? And I think that, so I'm just suggesting building into our annual calendar a few of these meetings that I think would be helpful, as well as in the fall, starting a conversation about Whatcom County's behavioral health legislative needs. So those are just a few kind of broad or specific issues and just some stuff for our calendaring in terms of our agenda that might make sense. So thank you.
Really good point. And for good of the order, folks that don't know, Brian is on the board of NAMI Washington, so he can bring kind of a useful lens on some of those kind of statewide pieces. Brian, we really appreciate your.
Yeah, it's NAMI Whatcom.
NAMI
just
Whatcom.
Affiliate, yeah.
Okay, thank you for
yeah.
the correction.
Sure.
Don't want to make it bigger than it really is. Any others from any other committee members, any from law enforcement that might be particularly useful for this committee to take on in 2023? I have down following up on xylazine, which I think kind of, if it didn't come from law enforcement, I know they're starting to touch it. But any other pieces? I know that we've got Chief Tank and Under Sheriff Chadwick, and I'm curious if from your lens, is there anything that this committee might take on that could be beneficial for your officers or how you do work, or just from your lens?
Yeah, just and Melora kind of touched on it with the LEAD program, and Grace, obviously our behavioral health deputy program has been involved with that from the beginning, and we're just starting to get the co-responder model off the ground. Actually had John Dukes come out, ride with Geraldine, one of our behavioral health deputies, and I know they're in the process of getting both of those behavioral health specialists hired. I think one of them's already hired, and then there's some additional training that has to come. And at that point, they will either ride or can ride with our behavioral health deputy or any other deputy for that matter. But I think the advantage of that is, one, they respond at the same time, and you've got a behavioral health specialist that, in addition to what the law enforcement officer is considering, you know, they can provide some perspective and some additional resources to maybe help divert that person that maybe even the law enforcement officers don't know. Like I said, as LEAD expands, that becomes more and more of a resource. Like anything, if you try and divert or you try and utilize a resource and it is either unavailable because of capacity, or which we run into with the Crisis Stabilization Center, as well as some of these programs as they added staff and got up to capacity. If they call and that's not available, at some point they stop calling just because that no longer is a resource to them, and they'll move on to something else. So as that expands and continues, certainly we'd like to see more diversion from law enforcement. I know that's also something that is considered, and we forward cases to the prosecutor's office for their consideration as well. So we're excited about the co-responder program. I think that provides additional resources at the same time in the field where people are, rather than trying to get them into a vehicle and bringing them into Bellingham. Now you've got people on scene immediately with law enforcement, and if it's no longer a law enforcement issue, the scene is safe. I know they're working on having their own vehicles, so potentially they can stay there and law enforcement can leave with, frees up that resource. That's one of the concerns about the co-responder model for us, is you now have a law enforcement officer and a behavioral health specialist in the car at the same time. And depending on what person is most applicable to the situation, they both have to stay there. And if they're able to respond in their own vehicle and things are stabilized and they can stay there to help get that person the resource and the help they need, the law enforcement officer can leave. And that's, with the changes in legislation, that's one of the factors under the duty of reasonable care, is if it's no longer a law enforcement matter, and maybe that is what's causing some of the mental health crisis for the person, then we can leave it and leave the behavioral health specialist to do what they're trained to do. So we're looking forward to that in 2023.
Thank you for that, Under Sheriff Chadwick. Chief Tanksley, not to put you on the spot, but wondering if there's anything from your lens out there in Blaine in 2023 that you're thinking of from a law enforcement angle, or something this committee you'd want to see us tackle or hear about. See if he's still able to get on. We know a lot of people multitask, so Heather, please go ahead.
I just want to really underline what you just said about handoffs and making sure we have adequate, warm, efficient, effective handoffs. I recently had an experience. I became friends with somebody who was experiencing homelessness, and I tried calling all of the resources that I know of, and I know of a lot, and there were dead ends in every place, and it was really stunning. And I think that one thing that could be helpful, maybe from a behavioral health committee lens, or maybe just a task force lens, it could be helpful for law enforcement with the Whatcom Resource Information Collaborative isn't ready yet, but what are the top 10 services, or maybe top 5, that are the most frequently needed? And then having that map of just who is the call and the handoff. And if there isn't enough capacity to serve people right now, that's a really important thing for us to know as a system. And I know when LEAD was started in King County, I think they had a red light, green light system for different services. And so officers could just see red light, don't even bother calling, or green light, I have capacity. So there's opportunity, I think, and I want to be supportive of that for sure, because I know that that's a real issue.
Thanks for that, Courtney.
This was brought up a little bit earlier, so this ship might have sailed, but I just wanted to, on the topic of reentry, I wanted to make sure that folks are asking the person who's actually doing that work. And Lindsay Clark, she's our reentry specialist at the jail right now. She's amazing. She's doing the work of like 30 people. And her voice is needed in these conversations. And I know locally there's a lot of, there are a lot of different meetings happening around reentry. And one thing I've noticed is that, at least the last time I checked, this could have changed since then. She has not been invited to those meetings. And I think her voice is needed because she can speak better than probably anyone here can about what reentry looks like right now, what is needed, what she needs to continue doing this work. Because reentry is happening. It's just there's only so much one human being can do, and she's doing great.
Courtney, if I could, I'm just gonna follow that train just a teeny bit. Does I believe it was Lindsay, is that is her name?
Yeah,
Apologies if I'm getting-
Chief Chadwick, or I might have misspoken on his title. Doug and Chief Jones can probably speak better to Lindsay's position within the jail. I just know it's through Lifeline Connections. But her name is Lindsay Clark.
That's certainly a position that Chief Jones has advocated for years. And like I said, there's more work than one person can do. And that's a critical role for people. You know, if depending on how long they're there, they obviously try and provide whatever behavioral health services they can to get them stabilized. But once they leave, making sure that somebody's there at the door to meet them and take them into that next phase for them, and hopefully directly to services. And that may be housing, that may be some kind of behavioral health or substance use treatment, that may be finding a job, trying to provide that stabilization in their life, as opposed to once they're released, there's no requirement that they leave the door. If there's no one there to help them, they're likely to return to whatever group and lifestyle that they were involved in, which is probably going to result in a very similar situation. And then that's that revolving door and that recidivism loop that we're trying to avoid here.
Really appreciate that focus on reentry from all of those different sides, and hearing that this one particular person could have something either for like a single session or maybe some ongoing representation. Laura, I see your hand up.
Yeah, I was just going to echo Courtney's suggestion. I think Lindsay has just really valuable information. She's part of the jail behavioral health team that is operated by Lifeline Connections, that is funded by the Behavioral Health Fund. And the council just passed an additional 3 positions so Lifeline will be posting for 2 more reentry specialists and another mental health professional.
Melora, since you chimed in, do you happen to know who they report to at Lifeline, or who we might reach out to? I think that would be useful. And that was going to be one of my pieces as a chair with our last 3 minutes, is just talking about behavioral health subcommittee membership. We have about 1 or 2 spaces open, and this is sounding like a pretty positive one.
Yeah, Julie Grindon is the
Yep.
regional director, but and
Yep.
I know they've been trying to hire a supervisor for that team.
Okay, great. Thank you. That's helpful. Courtney, did you have something else as well?
It was just a lingering thought on reentry again. Just another thing I think that's good for everybody to be aware of if they're not aware of already in those future conversations with the ASO, et cetera, is just what a logistical nightmare it is for all of us trying to link folks to services that are reentering the community when their insurance is shut off. And so when folks are incarcerated, they lose that insurance. And so the process of turning it back on, making sure that crucial piece is in place so that they can get that next step, whether it's housing, a PCP appointment, medications, et cetera. Usually it's all of that that's needed for one person. Very rarely is it one of those things on the list. So just figuring out a way that we can improve this, this shut off mechanism that we have. And I don't know what that would even look like, but it's a huge barrier that comes up with our office, with reentry. It changes the whole workflow of things.
Courtney, thank you for that. And that could be a piece, and I'm gonna tap on Brian and see if he knows. There was, I believe, a bill in the legislature trying to keep people on, and I think it was if they were going to be in jail less than 90 days, their Medicaid would not get shut off in the first place, meaning you wouldn't have this problematic trying to turn it back on and their services wouldn't interrupt. Brian, do you remember, is that a going concern this year in this session?
I don't believe so. I think what you might be referring to is a waiver that California got from Medicaid to 90 days prior to release. They reactivated the insurance.
Okay.
I understand it. I think there's a memo on that I can send around.
That's a good thing, Courtney, though, to put on 2023, because certainly beyond the scope of us here in Wacom to make change on that, but we can talk to the people that can. And Healthcare Authority, obviously, in the waiver for Medicaid waiver might be able to ask for that. So if that's not in the mix, that really should be. Melora, I see your hand up.
Yeah, I would just echo that an expansion to Medicaid for those incarcerated would help so much. Specifically the cost of medications, behavioral health medications, which are currently being covered by the Behavioral Health Fund and the CGTA fund. That money could be spent differently if we weren't having to cover those medications. I would also say, just an update for this group, the Response Systems Division is going to be posting a full-time transportation staff member on our team. And that's Mike Hilly is giving us the COVID van, and we'll be using that for care coordination purposes. So we see reentry and the coordination with the jail team and other essential teams in the community as that being another part of trying to figure out what does that warm handoff look like if the person doesn't have a ride, right? If that person needs to get from point A to point B. So we're hoping that having a vehicle and a full-time driver is going to help with one of those logistical pieces.
Great, thank you for that update. I'm looking at time, and I'm going to be amiss at running a little bit over, so I'm going to have to wrap us up. And Jill, I want to go to you real quick and see if we have any attendees for public comment.
Thank you. We do have 2 attendees. If either of you would like to speak to the committee, please virtually raise your hand now. And no hands are raised.
All right. Want to thank all the committee members for a lot of ideas. I wrote a lot of notes. Jill is always excellent at capturing a bunch. We'll try to put these in a digestible form so we can look at it. I do want to promote a couple of items coming up. Again, our next meeting in March will be a joint meeting. It's going to be a really good one. Really advocate that you all come. That joint meeting is March 14th at 11:30. And closer up next Monday, we're going to have our meeting of the task force as the whole. Really invite you to come. If I'm not mistaken, I think we're going to go over some of the SAC recommendations. Brian, really quick before we go, did you have something?
Oh, just
Good
that,
order.
Stephen and Michael, could you stay on for just a second to talk about our meeting tomorrow?
I can do that. All right, if there's nothing else, thank you all for your attendance today. We'll go ahead and adjourn the meeting of the Behavioral Health Subcommittee and look forward to seeing you all next Monday.